Chronic Diseases and Palliative Care, Part 7. I wanted to talk about ALS today. Hi guys, my name's Chelsea and I'm the Palliative PA. ALS stands for amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. This is essentially a progressive neurologic condition of the brain and spinal cord that eventually can lead to paralysis. Unfortunately, this diagnosis is a pretty traumatic one because it has such a short life expectancy, and during that life expectancy, there are very likely to be many problems ahead. So sometimes there are entire palliative programs dedicated to neurologic disorders because these are so complicated. And in my palliative program in general, we see a very small number of ALS, but we absolutely do see them. And I really do feel that getting palliative involved early on in ALS is super important because there are so many things to think about in advance and to talk about in advance that really need to be discussed in an ongoing basis. So not just once, but talk about them today, talk about them next week, talk about them a couple months from now when things change. Also making sure that you put this stuff in writing and that your family knows exactly what you want and what you don't want. Because I personally cannot determine what your quality of life would be. And that is the important question that comes up with ALS. You get to ultimately decide, what are you willing to go through with this disease? Some of the big pieces that we worry about and like to talk about early on are a support system. So who is your support system and who is going to help take care of you through this disease? And at the point that things become really bad, are you able to hire paid caregivers to take care of you at home? Or do you have enough family support that they can continue to support you? Or is it a situation where you would rather go to a long-term care facility where you actually have 24/7 care and nursing support? Some of the other important questions become, would you ever be okay with being on a ventilator if and when your breathing gets worse? Would you ever be okay with having a feeding tube if and when you stop eating appropriately? What is your quality of life? And this is going to continue to evolve throughout the course of ALS. So that's why having a good palliative care provider that you meet early on, get to know, and can talk through these things with is ultra important. And then not to mention filling out your advance directives, having a healthcare and financial POA, doing all of those things in advance. I'm sure that I will come back to this topic and talk about it again in the future, but please let me know what questions you have and save this for later. As always, follow along for more.